Getting older is kind of a fact of life, and that also means that at some point in time, either you'll need someone to take care of you or you will be taking care of someone else. That is our focus today on the Hear Me, See Me podcast. I'm your host, Melissa Bruner. Hear Me, See Me is a mental health awareness initiative based here at WIBW TV in Topeka, Kansas. Our guests today are two ladies who have been doing this work for a very long time, and an organization that's been doing this work in Northeast Kansas for a very long time. Michele Dillon and Rebecca Holmes are both with Jayhawk Area Agency on Aging. We have these agencies all over the area. Chances are you have one in your area as well. Welcome, ladies. Appreciate you being here. Whoever feels best equipped to address this, for those who aren't familiar, what is an area agency on aging? What does an agency on aging do?
So an area agency on aging is a place where folks could get information and resources regarding either themselves or somebody they're caring for. It's also a place for the Older Americans Act and the Senior Care Act, which are federal and state grants to house money so that it can be distributed statewide and countrywide.
So really,
why they were created, really, for the Older Americans Act to have federal funds housed there.
Because we are all getting older.
We are.
And this is really something that's kind
of... If you're 21, you're still getting older.
Well, and you know, we talked too about how, and this, as you publicize this, because you're a caregiving specialist, you're a brand person, so you're in charge of letting people know that you all exist, which is a very important thing. But anyone of any age, why do all of us need to know that an organization like this exists in our community?
Well, we like to say at JAAA that we're your partner in aging well. We're just not here for people who are 65 needing to maybe go into a nursing home or needing really complicated problem solving. We're here for the people who, as Michele says, are caring for their parents, caring for their grandparents. These issues affect the entire family, not just the person who's aging themselves.
Exactly. And we're seeing a lot more of that, aren't we? Are you seeing a lot more younger people accessing services, and or a lot more people who are in that 30s, 40s, 50s age range finding themselves in a position where they're caring for an aging parent?
The sandwich generation has a huge increase in caregiving, and we're also seeing a huge increase in early onset dementia, which makes the caregivers much younger. So it's been on an uptrend.
Do you feel like this is an awareness piece that we're seeing more of these cases, or is it simply that we are living longer than we were in, say, the 1900s, 1800s?
I think it's a little bit of both. Scientists would say there's some environmental factors related to the fact that more people are getting dementia and other medical conditions. So it's both, but folks are living longer, and trend is going that way.
Yeah, and unfortunately, so much of the time they're actually living longer than they planned, that they have the resources in place to take care of themselves as maybe their medical situation becomes more complicated every year.
So that's where planning becomes very important. How does it also change the services that JAAA and agencies like yours provide? In terms of, seeing the sandwich generation having to access this for their parents, in terms of now you have a generation, especially when you talk about the sandwich generation, and caregiving, being the person who's being cared for brings one, why do we address this in Hear Me, See Me? Because caregiving brings one set of stresses for the person who's getting older and has to accept the care, but also when you're also still trying to take care of your kids and your family, and you're running around doing whatever, and you're caring for the aging parent, now suddenly you're going, what about me? Where do I fit in? Do you find yourselves offering more services along those lines too? Respite, not just for the person who's getting care, but for the caregivers themselves?
Yes, I think the caregivers are the last people that are going to take care of themselves. The self-care is not really in their vision, and they also need to have some education on when is the time to make the decisions for their parents, because sometimes the parents can still make the decisions for themselves, and you don't really want to parent your parents. So things have transitioned into more of an education and finding the resources and letting caregivers know that it's okay to take a break and to have respite. You don't have to do it all.
Let's start with the definition of caregiving. Is there a set definition of caregiving, or if you had to explain what caregiving is, what is it?
Oh gosh, that's an on-the-spot question.
It's kind of broad,
It's
you know.
kind of broad. I mean, I would say that caregiving just is anything that involves caring for someone else. So, I mean, it could just be your neighbor bringing you some groceries. So, it doesn't have to be intensive. It's just a matter of, are you caring for someone else? And we're a caring generation, so we're all doing it for somebody.
How do you know that it's becoming overwhelming?
The warning signs, I think, for caregiver burnout is really what you're looking for.
Yeah. The caregiver burnout stuff is your medical condition increases, you're tired all the time, you're not getting enough sleep, you're not eating right. There's a whole list of them that I did not bring, so I don't have them memorized, but usually, so my conversations with caregivers are really based on a one-on-one conversation. So they'll call me up and say, what can you do to help me? And I'm like, we need to step back and find out what your situation is, because everybody is different and everybody's burnout rate is going to be at a different level, whether they have their own kids or if it's just them or if they have family on the in another state that's being helpful or not helpful. Those are all things that we talk about to see if there's actual caregiver burnout. But I think most of the time, if you are deeply stressed, depression, you're not taking care of yourself, you're not going to your appointments, and you're just so concentrated on that caregiving that it becomes a burnout situation.
What support do you have to offer folks who are finding themselves in that caregiving position? If someone comes to you, like you said, someone calls and says, okay, I have to care for someone, where do I start?
Yeah, so that conversation starts with what is the situation. So who are you caring for? What does that look like? What kind of supports do you have? And then from there we could talk about, I do have a grant currently for folks that are caring for somebody with dementia. So it's $1,000 that they could use towards respite. We bring a provider in to give them a break. But with that grant goes the conversation of, well, mom's not going to let anybody in. So we talk about, how does that work? How do we get that started? Is the dementia person really saying no, or do they not understand? So it's an educational piece there. I do a lot of boundary setting, how to talk about, well, mom says she doesn't need any help, but you're the one that's doing all of this stuff for her. So yeah, she doesn't think she needs help because you're doing it all. So we talk about that. So really, some of those conversations could last a half an hour to an hour, and the grant is just a good way to get those conversations started.
So let's talk a little bit about that grant, because there's a deadline attached to it, and who is eligible for it, what kind of geographic area, and when do they need to apply?
Hey, so our geographic area is Douglas, Shawnee, and Jefferson County.
In Kansas, yes.
In Kansas. And the grant lasts until the end of June. I think I said the end of July and that was incorrect, but it's the end of June, and then we have a new fiscal on July 1st.
And so what could that help people get?
So they could get in-home services with a provider coming in to provide some respite while they go out either for a doctor's appointment or to have lunch with friends, or whatever appointments they need to take care of, whatever respite looks like for them. Sometimes it's just, hey, I need 2 hours to go and see my tax guy to get my income taxes done. Whatever that respite looks like is what we want to offer. We can also offer to maybe help pay for a ramp or some shower heads if that's what makes their caregiving easy. It's really very individualized as to what's going to make things easier for you in your caregiving journey.
Individualized is such an important point to make, because I think when I hear a grant, I'm like, okay, I have to be part of an organization or a group in order to apply for something like this. You don't have to be. It could just be like you yourself and your family.
Essentially, the qualifications are you're caring for somebody in the county that has a diagnosis of Alzheimer's or a probable diagnosis of Alzheimer's. That's essentially it's not means tested. We don't ask you for financials. But do you need respite care and you're caring for somebody that has memory issues? then you qualify. It's pretty open.
Are these sorts of programs available in similar organizations to yours? I mean, for if anyone is listening or watching and they aren't in your specific county area, do they just reach out to a local agency and say, hey, do you have any financial help for me?
Yeah, well, the $1,000 grant is specific
to you.
Kansas.
Okay.
It's specific to Kansas. The Older Americans Act, we also have grants under that to help with some homemaker and bathing and respite, and that is a federal grant. So if somebody is outside of our county area, they would just call their area agency on aging, and there is an area agency on aging for every county, for every state.
So bottom line, you just need to ask, because Rebecca, I think, and this is kind of where your job comes in, I think people think they have to do it all themselves.
They do. Education is such an important piece when we look at caregivers, because of course, no one gets to practice this. Your parent suddenly is forgetting things, maybe in a dangerous living situation, and you have to jump in and really hit the ground running. So a big piece for our 3 counties is going to be the the Golden Connections Resource Fair, July 25th at Ag Hall from 9 to noon. It's a great family-friendly event, and we will bring resources from across all 3 of our counties into one place. Everything from caregiving and essential services to volunteering, ways to stay connected in their community, all in one spot.
You know, and it's, when you say that too, I think, you know, and I kind of alluded to this earlier, people think these conversations, when they hear about an event like that, you know, we have a program in the afternoon on our station, and I know our company stations nationwide have the Aging Untold show that airs
great.
now,
I've seen it.
and they think that, oh, well, I'm not 65 plus, I don't need to watch it.
Yeah.
These issues extend so far beyond that now.
Yes, absolutely. I think everyone knows an older person in their life. Even if it's not your personal family, everyone has someone in their neighborhood, their social organizations, their churches that maybe they'd like to help. They'd like to be that point of connection and really helping that person get to the right resources.
I've actually gotten several calls this last week on people saying, hey, I've been helping my neighbor, and now my neighbor is doing this, and I don't know what to do. So I've actually gotten several calls regarding that this week. So people are looking out for their neighbors, and you know, when there's no family involved, you know, I worry about that myself because I don't have children. So you know, how I will age gracefully with
Same.
help. So
God bless my nephews. They don't know it
yeah,
yet, but
yeah.
they're going to be looking out for me.
I mean, I think it's important to have an organization, and I love working for an organization that's main goal is to just find the resources for folks. You know, we're not looking for. We have enough people out in the community that require services. We're not out looking for it.
Yeah. What are some of those warning signs when you mention looking out for our neighbors, and some of those things that people are calling you saying, I noticed this and I'm wondering, should I be doing X, Y, or Z?
I think a lot of times the first thing people are looking at is somebody paying their bill? Are you going to their house and seeing a whole stack of mail that's just sitting there? That's really a good indication.
Interesting.
A lot of folks get scammed. When they get scammed, that's a good indication that there's the starting point of something going on. Is the food in the refrigerator expired? Those kind of simple clues that you don't really think about. Do they have food in the refrigerator? Are they just making meals in the microwave? How simple have they made their life? And a lot of times if you go in and you start to see a hoarding situation where there hasn't been one before, that's sometimes a really good indicator that there's some kind of dementia starting, because they don't quite know how to organize and sort anymore.
Interesting.
And the personality changes, of course, that come with dementia and Alzheimer's is often a really great
More
warning
agitated.
sign. A little bit more agitated. They get a little bit more upset about things than maybe they did before. Especially if you've known them a long time as family or neighbors, that usually is the first clue that maybe something's not quite right.
So you mentioned you get the call, you tell people, yes, maybe there's a sign. We talked about where do you start, what's the first thing, and you go through some things that you mentioned to people. Then what happens from there?
Well, then we find what is a good solution for that. I have an adult day, so maybe that is a good solution because it's an inexpensive option for them to get some respite for 8 hours a week. Maybe a good solution is to introduce somebody into the home a couple of hours. I think a lot of times they're like, well, mom's not really ready to have somebody in their house. And our conversation is, well, you start out with like 2 hours, maybe twice a week, for them to just establish a relationship with somebody, to have somebody else to communicate with. And then at the time when they need some more additional assistance, like bathing help or some kind of attendant care, that person who's come in and started that relationship is not a stranger to them. So that makes that transition easier. So even if they're starting out with 1 hour a week, or somebody goes out with them to lunch that's someone besides you, that is a good way to get that door open, because you don't want the shadowing, and it just helps the caregiver when they establish a relationship with someone else.
When we talk about the caregiver then taking care of themselves, because you keep mentioning the respite care and having that break, how vital do caregivers need to realize that is? I think sometimes, we think it's a failure on our part if we can't do everything ourselves. I mean, these are our parents. They took care of us for so many years. We should be able to handle this. So thanks for telling me what to do. Now I've got this all lined up, but I'm still doing it all myself.
Yeah, that whole analogy of put your oxygen on mask on first before you help someone else is so vital, because if you can't breathe and you're stressed, you certainly can't be of good help to someone else. I heard something the other day which really struck me, and they said sometimes a bad caregiver is a good son or daughter, and sometimes a bad son or daughter is a good caregiver. Those two have to be separate. I just love that phrase, because it kind of puts things in perspective, that you have to, in order for you to be the best caregiver you can be, and nobody else is going to take care of your mom better than you, we all know that, but in order to be the best one you can be, you have to be able to put your oxygen mask on and breathe and have that respite care.
I think also people tend to underestimate how isolating caregiving can be.
Yes,
when
you
that
can't
person,
go anywhere.
you can't go anywhere.
Or you feel like you can't.
You can't, because then you're leaving them alone and vulnerable and uncomfortable. So that comes with a lot of emotions. So having someone like Michele step in and kind of get a read of the entire situation as a neutral third party can be really helpful to the families to then come up with a plan.
Thank you for being our mediator.
Yeah, I do a lot of boundary setting and a lot of, and I find most of my caregivers really appreciate the truth and the honesty that comes with the conversation. Like, this is what's going to happen further on down the line. This is what we need to expect further on down the line. How are we going to plan this? When does it become a safety issue for them to be home alone? We've all made the, I always tell them, please don't make the promise of, I'll never put you in a nursing home, because you don't know what tomorrow's going to bring. And if it becomes a safety issue, we have to look at that. Everybody wants to age in place, but a want and a need are two different things.
Interesting. Well, we're going to talk about the flip side of this as well. For the person who is aging, what's kind of going on there, as well as a big anniversary for Jayhawk Area Agency on Aging, when this Hear Me, See Me podcast returns in just a minute. Welcome back into the Hear Me, See Me podcast. We are speaking today with Michele and Rebecca from Jayhawk Area Agency on Aging, based in Topeka, Kansas. All things aging and caregiving, which is such a wide-ranging issue. We talked about how to seek care, why it's important to seek care. If we could take a moment to look at the flip side of it, the people who are getting older. What's going on in our minds as we're getting older? And I think maybe the big one is, we don't need help. We're doing just fine. What's going on with us that makes it so hard to admit?
Well, because we feel like we've just been independent our whole lives.
Oh, heck yeah.
And the way I explain it is, we really haven't been independent our whole lives. I mean, if you have a leak in your sink, you call a plumber. If you have a medical issue, you go to a doctor. If your car breaks down, you go to a mechanic. So we rely on somebody for something at some point our entire lives. And so people need to look at it that way, that it's not really a sign of weakness to ask for help. And sometimes in order to be independent, we have to be dependent.
Mentally,
and I think they need to kind of get into that frame.
Absolutely. Mentally and emotionally, how hard can that be sometimes? What do you see with people?
Well, I think it's very hard. And I think also with some of the older generations, we didn't have the aging in place supports that we do now. So a lot of times somebody would come in and see you need a little bit of help. So you immediately need to move out of your house. And so that's where they automatically go because they're just used to that communication from, back in the 60s and 70s where we didn't have any other options for in-home care. It was all either you were completely independent or you moved out. So they need to kind of understand that there's other resources and there's ways that you can age in place safely, and sometimes you just can't age in place safely, and there's nothing wrong with either one of those options. But also on the flip side, I think people need to understand that if you are alert and oriented ×3, I don't care if you're 104, you have the right to make your own decisions, and we as adults have the right to be stupid. So
there is that, right?
I mean, we need to let adults be adults if they have the ability to make clear, concise decisions, and stop parenting them and telling them, Mom, you need to do this, and Mom, you need to do that, because
Speaking
hard.
of that, I think that
hard.
is the hardest thing, is that role reversal. The parents are used to being the ones in charge. They organize things. They tell people how things should be done and the right way of doing it, which is their way. So then making the shift to their children or other family members or maybe younger friends, then saying, oh no, actually, you need to do it this way. That is incredibly difficult for us.
Well, but you mentioned earlier that sometimes a little bit of a personality change, noticing a little more agitation. Yes, it can be a warning sign of dementia. However, how much of that can we as kids, do we need to kind of scale back and be a little bit understanding of our parents that, what, it is frustrating. And I noticed this with my dad when suddenly he had some health issues. He had a little bit of a stroke before he passed away. And suddenly he couldn't just get up and go anymore. I would think that just emotionally, mentally, that is hard for a person to accept. And we need to give a little grace that, okay, this is some frustration over not being able to do what you once did.
It totally is, because they are frustrated with the fact that their lives have changed, and we need to be empathetic to that without being bossy about it. So I think it's a hard line to figure out for the caregiver how to market things in such a way that the decision becomes a group decision and not I'm telling you what to do decision. How do we market that? And that's something I can help people with, on how we have that conversation and what that looks like. And we're not going to say no and do all of those things. So
I love the idea of giving them some grace, because of course we have to all remember that eventually, if we're lucky, we will be in their position. We are all going to reach those ages where we have to make these decisions that we know are going to be tough for us. So kind of putting ourselves in their shoes from their perspective and having a little bit of empathy can be really helpful as well.
Are there programs for older adults as well then, for those of us who are aging, to kind of understand what's happening with ourselves physically and how that impacts us mentally, and then maybe helps us with that transition? Are those things that agencies on aging can assist with as well?
Yeah, we do some pieces of education. We do have an exercise group that we run called Drums Alive, that is a great physical balance, strength, all those things, as well as a cognitive exercise. So we encourage people to take part in that. And then in 2027, we will be launching a Lunch and Learn series where we bring in experts from many topics across the community to come in and really educate the people.
That makes sense. Because I'm thinking to myself, I really would like to, I say, I want to go run another half marathon. And then my husband's like, okay, but let's be realistic. You've already been told that your body has changed a little bit and that you have this muscle thing going on. Is this really the wisest thing? And I say, of course it is.
I think that we, as we age, we need to understand that we can still be useful in a different direction. We don't always have to be, we retire and so we felt like the job was what was part of us and that's what made us who we are. But we were people before that job. And so we have to learn where our usefulness continues to be as we change.
We talked about how isolating caregiving can be. How isolating can aging be? We hear about loneliness among older adults.
It can be very isolating, because I do feel like, first of all, I think some of the aging, as we talked about, some of them want to be so independent that they kind of don't want the help. They don't want people coming in. which is a mistake. And then I think sometimes we kind of think people are doing okay, and then we don't check in on them just to visit. I mean, I have some people from church that I just visit and have conversation with, and that's my way of checking in on them, kind of thing. So I think as a society in general, we've all become a little bit isolated, and we're not the generation of let's meet the neighbors anymore kind of thing.
But we need to be.
We need to
We
be.
need to
Yes,
be.
we do.
We do.
When it comes to taking care of ourselves, we talked about caregivers and how that can be very taxing on someone. You have some support groups, and how do you seek those out? What happens in those support groups?
Yeah, I have 3 support groups in Topeka, and I have 2 in Lawrence. And basically, it's a chance for caregivers to kind of get together and share with other folks what's going on in their lives. And it's the ability for them to see, oh yeah, this isn't not only happening to me, this is happening to other people. And then those other caregivers can say, hey, well, this is what worked for me. Maybe it'll work for you, or this is how we handled it. And it's just an ability to support folks on their journey of caregiving, whoever they're caregiving for, and to just say you're not by yourself. We're a community here.
What kind of change do you see in people when they are able to make that connection in those support groups?
Oh, it's huge, because they understand that how they're doing it is going to be right at that moment, because we don't have all of the answers, and you may have felt like maybe I didn't handle this the right way. But when you get the support of people that said you did the best you could with the information you had, it's huge to relieving stress and to understanding that you're doing the best you can, and you need to you need to give yourself a little bit of grace.
Just reach out to your local agency on aging to find out if any of those support group type of resources are available in your area. You're going to add?
Well, I was just saying, it kind of ties back to the caregiver burnout that we were talking about. So much of their lives becomes tied up in the person they're providing care to. So that's an opportunity to go to a time that's really focused on them, their stresses, their anxieties, and kind of get the support of people also walking through it. So as Michele said, it can be incredibly beneficial.
Go ahead.
I was just going to say, also another way for folks to feel useful is if they're not caring for anybody, but they'd like to look into that. We do have an adult day group that we run that is very inexpensive to caregivers because it's volunteer based.
And you need volunteers
and
in order to
need
make that
volunteers
happen.
in order to make that happen. And it's basically an opportunity for us to socialize with some older folks that have had amazing experiences in life, veterans and all of those kinds of folks that have done for us, so we can return the favor. And you also get a free lunch.
I like that. It's always good. But you're right, it's a great way to get out and about and have some rewarding time. And you've got volunteers for all sorts of things. This is not a new topic. Caregiving, aging. I mean, we've been getting older for forever, because otherwise we as human beings would not be here anymore. And so how long, there's a big anniversary for Jayhawk this year?
Yes, it is. This is our 50th anniversary. Wow. We're incredibly proud of it, and the work that we've been able to accomplish across the 3 counties and in your communities for the last 50 years. But of course, now we're looking forward to the next 50. Whenever I meet people in the community who says, oh, I'm not quite there yet, I said, okay, but we will be here when you are. When you're ready, we'll be here with some help.
What big celebrations do you have planned?
Right, so the Golden Connections Resource Fair is one, and then we're having a Golden Gala. It'll be at the beautiful K. McFarland Japanese Garden. We'll have a live celloist playing in the gardens, complimentary photos. It is a formal event, really going to be elegant, and a silent auction that I'm very proud that all of our vendors and donations for the event are from local Kansas businesses.
Super fun. So you'll have that information on your website, I'm sure,
Yes.
to get the tickets for that benefit coming up in September.
And I always say follow our Facebook page, because we keep that updated with all these activities, events, everything coming up.
And you're probably your own local agencies on aging. They've all been doing this work for decades. And so if there's a milestone coming up that you want to help celebrate in your own community, please do that. So, gosh, we've covered a lot of ground with this conversation today. If there's a final thought to sum up, if people take away nothing else, Michele, from this when it comes to caregiving, what do they really need to know?
I think what they really need to know is that there is help out there for you. There are answers, and asking for help is really the best thing that you could do for yourself in your journey.
What about for you, Rebecca?
Well, I would say we would love to see you all at any of the events that we have coming up at Jayhawk Area Agency on Aging. We're really proud to be part of your communities. If you've never reached out to us before, we really encourage you to take that first step. I swear we're all really nice people. It won't be intimidating at all.
In Topeka, your website for Jayhawk Area Agency on Aging is?
jayhawkaaa.org.
AAA. But again, as they both have stressed, every county pretty much across the nation has one of these.
Every county in every state has an area agency on aging that covers. So if you just Google your county and put area agency on aging, you would come up with the one that's local to you. So, and I would add, if you're a long distance caregiver and your mom is in Texas, there's a area agency on aging that may have some in-home services that could help mom who lives in Texas.
Very important. We are such a mobile society these days that it's nice to know that, gosh, if you're not there every day, you can reach out to someone who's going to be a little bit closer to you. Great information, ladies. Thank you so very much, because no matter what age you are, no matter what stage of life you are at, these services are there to help you out, to be there to support you, and to let you know that we hear you, we see you.